What has Dr. Thompson told you about why you think you need to come back and see me?
Very little, really. My situation has changed slightly. He seemed to think I should see somebody a bit more important.
Okay, that's fine. We first met, of course, about 10 years ago.
Yes, we did, yes.
When this problem was first diagnosed. And looking through your records, we had a discussion then about the risk of stroke and about the various treatments. And it was decided between us at that point that you would go on to aspirin,
Yes.
which you've been on for 10 years.
I've been taking it, yes.
How have you been getting on with that?
Absolutely fine. Yeah, no problems at all.
No problems, okay.
And I feel fine.
Good. So, but things have changed. So, from my understanding, and correct me if I'm wrong, you've developed type 2 diabetes?
I have, yes.
Is that right?
Yes.
Okay, and unfortunately, you're also 10 years older. The difference with this is now, if we compare you to 10 years ago, your risk of a stroke has changed because you've got a bit older and you've developed diabetes. And these two factors combined show that you have now a higher risk of having a stroke. And that's one of the reasons why your doctor has sent you to me to discuss whether or not we switch you from aspirin to a more conventional blood thinning tablet and anticoagulant.
Yes, I mean, he mentioned that at the time, and I made it clear to him I wasn't really very interested at all. I mean, I'm quite happy with the way things are with the aspirin. I've been taking it every day. I don't feel ill. It seems to be working, like I said. So I don't understand this at all.
No, that's all right. So, but the difference is, as I said to you, that compared to 10 years ago, your risk has now changed. So you're now in a situation whereby, if we look at your risk of a stroke, whereas 10 years ago, compared to somebody else who didn't have atrial fibrillation, your risk was very similar. Now we're in a different situation. Compared to somebody else who doesn't have atrial fibrillation, you have a risk of about 4 in 100 of actually having a stroke in the next 12 months. And that risk is cumulative, so that means the year after there's an 8% risk, etc., etc. So you've got a significantly higher risk than you had 10 years ago.
Yeah, but why? I mean, actually, in real terms, why? Why have I got a higher risk? I mean, what does that mean? What's different about me because of all these things?
The difference about you is that you've got older and you developed diabetes.
Yeah, well, you said that, but, you know, that doesn't mean a great deal to me.
But what it means is that there's a lot of evidence that has been produced in the last 10 years which actually shows that if we take people who've got diabetes and who are more elderly, they have a higher risk of stroke. If you look at strokes overall and atrial fibrillation, they are a condition that become more common and more troublesome the older one gets. So if you look at people with atrial fibrillation, in the general population, at the age of 70, only about 10% of people will have atrial fibrillation. But when you get to the age of 80, about 30% have it. So strokes and atrial fibrillation become more common as you get older. And then you add the compounding factor of having diabetes develop as well. Yeah. Diabetes can also affect the blood vessels in your heart, in your blood vessels, and in your brain. And therefore, when you add that into the age, it all increases your risk of a stroke. And that's why the figures have changed compared to when we met 10 years ago. So just to summarize what we've said so far, you've come to see me with this problem of atrial fibrillation that you've had for about 10 years or so, and you've been taking aspirin. The one thing I've said is that over that period of time, your risk of a stroke has changed. It's such that it's now increased because of your age and your diabetes. One thing I'm not totally clear about is having a stroke important to you, or avoiding a stroke?
Of course, yes, absolutely.
I note from the records that Dr. Thompson said, in fact, your mother had a stroke, in fact, a hemorrhagic stroke. She bled into her brain because she was taking warfarin for atrial fibrillation. Yeah. How was that? Was that a devastating stroke?
Absolutely, yeah. Oh, yes, yeah. I mean, she was quite severely disabled, and it definitely shortened her life. There's no doubt about it. And that's one of my main reasons for not wanting to touch it.
Right. So I see. So that's slightly different. So it's not just the fact that the aspirin seems to be working at the moment.
Well, there is that as well.
But you're not happy with the warfarin because of the risk of bleeding.
Yeah, and it seems to be, you know, quite a high risk from what I hear. I mean, it causes bleeds.
It does. So talking about the risk of a stroke, perhaps I can help by drawing a table just to give you an idea of what we're talking about.
Right.
At the moment, there are two types of strokes that we've discussed. There's the risk of the clot and there's a risk of a bleed.
Yeah.
You're currently taking aspirin.
Yes.
The evidence would suggest at the moment that makes very little difference to the risk of a clot in your brain as opposed to taking nothing.
Right.
However, it does significantly increase your risk of having a bleed into your brain.
Okay.
If we now look at warfarin, which your mother took, that significantly reduces the risk of a blood clot forming in the brain or traveling to the brain. It does increase the risk of a bleed on the brain, but not by as much as aspirin does.
Right.
Does that make sense?
Yes, yes, I understand.
If we look to one of the newer drugs, so-called DOACs, they reduce the risk of the blood clot traveling to your brain about the same as warfarin, so much more so than aspirin.
Yeah.
They increase the risk of bleeding into your brain, but much less than warfarin and than aspirin.
I see.
So that all is a bit complicated. So can I just check, what's your understanding of what I've explained to you? What do you think?
From what you've said is aspirin has no effect on that, but it has a large effect on a bleed on the brain. Warfarin reduces the clots, but does cause a bleed on the brain, but not as much as aspirin can.
Yeah.
And what was it again?
They're called a DOAC, but
Right, okay.
an alternative
Yeah.
to warfarin.
Yeah, they reduce the risk of clot similarly to warfarin, did you say?
Yes.
And can cause a bleed on the brain, but less than both of the other two. So if you score out all the ones that I think that's
the one that actually is the one that comes out a winner.
Yeah. Yeah.
It's not going to take things away completely.
No, I know.
I can't do that. But what I can say is that at the moment, with the aspirin, to try and put this together, your risk has changed, and you're currently running a higher risk of having a stroke with aspirin than you were 10 years ago. Mm-hmm. With advances in medication, that risk can be reduced significantly. The concern you have about the hemorrhagic stroke, the bleed on the brain, can also be addressed because the newer drugs reduce that risk even compared to what you're taking at the moment with aspirin.
Really?
Yes.
There is still some risk, but it's not as, yeah.
Yeah. But it's not
and
as
they
bad
would
as the moment.
effectively stop, well, hopefully stop
They will
the
reduce
damage
it to a
that
large
atrial
extent.
fibrillation's doing.
To a large extent, yes. There's no guarantee in
No,
life,
no,
as you would
no.
expect. But yes, but it does significantly make
I mean,
a
it seems to
difference.
me I should stop taking aspirin, PDQ, really.
It's not doing a lot for you, I would agree. And then you need to decide whether or not you need to want to take one of these other drugs. I think you're absolutely right. The first thing is the aspirin is not helping, so that's good. And then you need to decide whether to take one of these drugs. What I would suggest you do, while you're still thinking about this, is that I will give you some information to take with you, and I'll send it in the post to you. So I'll give you a sheet which is a decision aid that gives you the information about the drugs and about the risks versus the benefits. And I'll put all this in a letter which I'll send to you, and then you can think about it. If you want to come back to me and have a further discussion, or if you want to phone me up, the number will be on the letter, and we can have a further talk.
No,
and I can help you make a
I would
decision.
come back however I feel about it.